Hi, my name is Will Ross. I'm the project manager for Redwood MedNet, and I have a short presentation, which is a good thing because there's not a lot of time left. The project that we're working on here, in addition to the Pfizer-funded project that Dr. Hogarth presented earlier about doing analytics from the HIE into the EHRs, we have a grant from Cal eConnect to implement a direct messaging solution, the direct project, certificate secured email, in the transitions of care between a critical access hospital and an unaffiliated long-term care facility. What I've shown you here is the homepage on the direct project wiki. You can follow the project by just going to that page and seeing how it evolves. We're running down the racetrack at the moment, trying to get to the end of this project in time. We have not completed all of the tasks. The investigation is a little more cumbersome than we thought. The basic issue that we're studying is both directions. When a patient is transferred from the hospital to the long-term care facility, we're also studying the workflow in the other direction. Next slide. And so what we're looking at is, let's talk about the hospital transfers the patient to the SNF. Right now, it's an all-paper process. The hospital has, in our case, we have 2 hospitals we're testing this workflow with, and 2 unaffiliated nursing homes. And in the first hospital, there is actually a very comprehensive electronic environment, but it's a paper scan and archiving system. So they're not on EHR yet. They expect to be on EHR sometime before the end of next year, but they're not right now. However, they happen to have a lot of data in electronic format. It just happens to be an archive. So the question is, when the case manager is placing a patient over at the nursing home, can that current workflow, which is go to the paper chart, take out the documents, the 12 documents that you need, photocopy them, fax them, can that be replaced with an electronic process? So next slide. So the theory is behind this investigation is, yes, it can. We will just replace direct messaging instead of this photocopy and fax method. We will use direct as it was intended to replace faxing with a simple electronic transport. Unfortunately, this actually hasn't been real optimal for the workflow. There are a lot of documents. It's not an all-electronic environment. The documents at the hospital are in various states of readiness. It's actually not the case manager that would have to assemble them. It's the records department. So as it turns out during this investigation, we've decided no. The direction from the hospital to the SNF isn't going to be using direct messaging, not at this time. It's just not ready. Next slide. So now we're asking the question from the other direction. When the SNF is pushing a patient over to the ER, this is generally, when we wrote the proposal, we thought it was going to be a planned acute visit, but as it turns out, most of the traffic from long-term care patients that are admitted to the hospital are not pre-planned acute visits, they're unplanned visits. So this is the theory, this is the as-is workflow right now. We have records that need to accompany the patient. They are printed or photocopied if they're handwritten, and they're either faxed or, in some cases, taken with the patient in the medical taxi. Next slide. So this is the theory that we can introduce direct messaging as a form of automation. And as it turns out, this is working. We don't have it in production at the moment. We're still patterning the handoffs between the players and how to balance and optimize the workflow. But we anticipate that within a few weeks, we will have some pilot messages going back and forth, and we'll be able to report on that. So as it stands right now, I've put the location of the Direct Project Wiki on all the slides, and you can follow this project. We'll be reporting updates on the wiki into our investigation of use of direct messaging to transport transition of care documents between long-term care and a hospital.